This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday morning. Thanks for joining us on WHAR. I'm Kyle Wiggs, and we're pleased to be joined by Dr. Sheetal Nijhawan. And she is a bariatric and general surgeon and part of the team and the family at Mon Health. And Dr. Nijhawan, good morning. Thanks for your time this morning.
Hello, good morning. Thank you so much for inviting me to your show.
First of all, give us a little background on you, where you're from, and how your path originated, how you ended up here in Morgantown with the Mon Health system.
Well, I'm originally from India. I have been practicing general and bariatric surgery for the past several years. I completed my residency at the Cleveland Clinic in Cleveland, Ohio, and then I specialized in minimally invasive and bariatric surgery at the University of California in San Diego. I spent several years in Sharon, I think close to 11 years, where I was also deeply involved in hospital leadership. I was the medical director of the Center for Weight Control at the hospital and also president of medical staff. And now I'm here at Mon Health Medical Center in Morgantown and their medical director of bariatric surgery. I'm very excited to be building and leading their bariatric program.
So from San Diego, where it's sunny and 70 degrees every day, to West Virginia, where you get to enjoy all four seasons, right?
Yes, I think that's you got it.
All right. So define for us bariatric surgery, what it is, and who are the candidates for it.
All right, so it's a great question. So bariatric surgery is weight loss surgery, but it's really so much more than that. It's metabolic surgery that treats obesity and health-related conditions and related health conditions to obesity. So I would say it's designed for patients who are facing serious obesity-related health problems. We are talking about people with a BMI or a body mass index over 35 who have serious conditions like diabetes, high blood pressure, or sleep apnea, or those with a BMI over 40. So these are all patients who have tried traditional weight loss methods like diet and exercise, but they continue to struggle with their weight and health.
Mm-hmm. So the surgery actually changes how the digestive system works, right? Can you explain that a little bit?
Yes. So it's actually a combination of different mechanisms working together, and it's more sophisticated than people actually realize. So first, there's the obvious part that the stomach becomes smaller when you operate on it, so you physically can't eat as much. So you feel full faster and you stay satisfied longer. But what's really fascinating is that these operations, they change your body's metabolism itself and the hormones. After surgery, we see so many changes in the hunger hormones like ghrelin, which decrease, so patients feel less hungry. We also see improvements in hormones that regulate blood sugar and insulin. And so for many patients, especially after gastric bypass, we see diabetes improvement or even remission within days before even significant weight loss starts to occur. And that's because of these metabolic changes. And the weight loss itself then leads to other improvements in blood pressure, in sleep apnea, joint pain, cholesterol levels, fatty liver disease, and so on and so forth. And patients often tell me that they have so much more energy, they can move more easily, they feel like they've gotten their life back. It's truly a comprehensive reset for the body's metabolism and not just a reduction in stomach size.
Mm-hmm. So that helps with all the long-term goals. It's not just weight loss, although that's a main byproduct of it. It helps with long-term health with all of those things you mentioned.
Absolutely. You're absolutely right.
Okay. So the most common types of bariatric surgery, there's two basic ones, right?
Yes, there's two common procedures that are performed all over the country, and these are the gastric sleeve and the gastric bypass. These are also the most commonly covered by insurances as well. So the gastric sleeve is where we remove around, say, 80% of the stomach. It creates a smaller stomach, almost in the shape of a banana, so to say. So this will limit how much you can eat, and it will also reduce the hunger hormones we just spoke about, like ghrelin. So it's a very popular operation just because it's very effective, and it's also simpler as compared to the bypass. Gastric bypass, on the other hand, is a little bit more complex, but it's a great operation. So in that operation, what happens is that we create a small pouch from the stomach, and then we connect it directly to the small intestine, bypassing most of the stomach and a part of the intestine. So this will limit not only how much food you can eat, but it also changes how your body absorbs calories and regulates blood sugar, which is why it's particularly effective for diabetes as well. Mm-hmm. So that's why these operations are also called metabolic operations. So both these procedures are usually done in today's day and age in a minimally invasive fashion with small incisions, and this will help with faster recovery and less pain as well.
Yeah, that's the thing. I would imagine that the techniques have changed and advanced and evolved. You say you've been doing this for 7 years, correct? I would imagine you've seen many changes to where these procedures are minimally invasive compared to what they were, 7, 10, 15 years ago?
Absolutely, yes. So I've been in practice for now close to 15 years, and 11 years of that I've been in Sharon, Pennsylvania. So, yes, I've seen a lot of patients who've had these sets of operations, and initially we used to do them laparoscopically, but now we've transitioned to mostly robotic surgery, which is even better because it's you can do really complex cases in a very efficient and safe manner. And the incisions, like you said, are very small, and so the recovery is much faster for patients all around.
So if someone is listening and they think they may be a candidate for one of these surgeries, either the sleeve or the bypass, what is the process like? What's the first step to take, and where do you go from there?
All right. So first, how do you know if someone is a good candidate, right? So there's both medical criteria and personal readiness factors that we look at. So from the medical standpoint, candidates, they'll typically have a BMI of 35 or higher with obesity-related health condition like diabetes, high blood pressure, or sleep apnea. Or if they have a BMI of 40 or higher, regardless of any other conditions, they would qualify in the most part. So typically, I like to see that patients have tried other weight loss methods without long-term success so that they are really mentally ready as well for the next step. But numbers are really part of it. So I'm also looking for the patients, whether they are mentally and emotionally prepared for this journey, because you need a lot of commitment for this. So are they willing to make permanent lifestyle changes? Do they understand that this is a tool, not a magic fix? And do they have the support system? We look at their overall health as well. If somebody has uncontrolled medical conditions, we'll work on stabilizing those first. If there are psychological concerns like untreated depression or eating disorders, we want to address those before moving forward. So in the end, I think the best candidates are people who are committed, realistic about what surgery can or cannot do, and are ready to be active participants in their own health transformation.
Mm-hmm. And like you say, it's a commitment from the patient as well. There is some education in terms of nutrition and lifestyle changes that person needs to commit to, correct?
Yes, absolutely. They need to be committed to make the changes, and we will help them in our program with all of these steps once we start with the process.
Okay, what about a doctor's referral to see you and your team?
So in the most part, some insurances will require referrals from their primary care physicians, but other insurances do not require referrals, and they allow you to self-refer and schedule directly. I always encourage patients to check with their insurance company first to understand their specific requirements, but honestly, even if a referral isn't required, it's often helpful to talk to your primary care doctor first because they know your medical history and can be a great partner in your weight loss journey. Mm-hmm. Also, if someone is really interested in exploring bariatric surgery, I always encourage them, please call our office so we can help you understand the process and your options.
Mm-hmm. Okay, what about, before we take the break here and talk about the procedure itself and the recovery, what are some myths or misconceptions that maybe you encounter or your colleagues encounter about these types of procedures?
So that's a great question because I hear this all of the time, and I'm glad you asked this. These myths can really stop people from getting the help they really need. I think the biggest one is that it's the easy way out or it's cheating, and that couldn't be really further away from the truth. Surgery is really a tool, but patients still have to do the hard work, and it's a lot of hard work, changing their eating habits, exercising, attending follow-ups, taking vitamins for life. It's not really easy at all. So another common myth is that bariatric surgery is purely cosmetic or vanity-driven. And this is a medical treatment for a serious disease. We are treating diabetes, heart disease, sleep apnea, conditions that are literally life-threatening here. So I also hear people say, I should be able to do this on my own through diet and exercise. So yes, diet and exercise are very important, but obesity is a complex disease involving genetics, hormones, and metabolism. And sometimes willpower alone isn't enough, and there's no shame in that. Some people worry that they won't be able to eat normally again or they'll be miserable. Truth is, patients adjust to the new normal. They eat smaller portions, make healthier choices, and most importantly, they feel so much better than they have in years.
Mm-hmm. Very good. Well, we'll again talk about the procedure and the recovery after we take a quick break. Dr. Sheetal Nijhawan is with us, and she is bariatric general surgeon and the director of bariatric surgery with the Mon Health Systems. We'll take a quick break. We will continue the conversation on Mon Health Talk for this Monday coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. We are visiting with Dr. Sheetal Nijhawan, and we're talking about bariatric surgery. Dr. Nijhawan with us, and she's been conducting these type of procedures for many, many years now. We talked in the first segment about candidates for the surgery and some of the myths surrounding the surgery. Now, doctor, someone is preparing for the surgery. What's it like for them leading up to it? What kind of preparation goes into it?
That's a great question. So this is a major surgery and a life-changing decision, so we do have a thorough preparation process. So usually it'll take around 3 to 6 months from the first consultation to the surgery day. And during this time, patients will work with our entire team, not just me as the surgeon, but dietitians, psychologists, and sometimes other specialists as well. So we'll do comprehensive medical testing to make sure that patients are healthy enough for surgery. They'll learn about nutrition and start practicing new eating habits as well. They work with a psychologist to address emotional eating patterns and prepare mentally for the changes ahead. Insurance will typically require supervised weight loss program during this time. I know that sounds so frustrating to a lot of patients who are eager to move forward, but really it's a good thing. It's very valuable. Patients are starting to lose weight. They're building healthier habits, and it starts to form a foundation for their whole life journey in the future. By surgery day, that means the patients will not be nervous. They're very excited. They're very prepared because they understand exactly what's happening and what comes next.
Mm-hmm. Okay, so what about recovery after the surgery?
So recovery, most patients are very pleasantly surprised by how smooth the recovery is because they're so very well prepared before the operation itself as to what is going to be. There's a lot of education. Most patients are in the hospital overnight only, sometimes two, depending on their medical conditions. And we have patients up and walking the same day. I know that sounds really tough, but it actually helps patients feel better and faster and prevents complications. So I think the biggest adjustment is the diet progression. Patients will start with clear liquids and then move through stages over a month or so until they're eating regular food again, just in smaller portions. It does take some getting used to mentally, but patients really, they don't feel as hungry anymore. And so it's not as big a hurdle as people think about it preoperatively.
Mm-hmm.
Pain-wise, we use small incisions because of our robotic and laparoscopic approach, and it's surprisingly manageable pain. Most patients describe it as a soreness rather than severe pain. We do prescribe pain medications, but I have seen that many people need it less than they expected. Most of the patients, I think, will be back to normal activities within 2 to 3 weeks. They feel tired at first as the body is healing, but that energy comes back very quickly.
Mm-hmm.
The most important thing is that patients are not alone in this. We see our patients frequently during these first few months, and they can call us anytime with questions or concerns.
What kind of results do you see in your patients?
The results can be truly life-changing, both in terms of weight loss and health improvements. From the weight loss standpoint, most patients will lose around 60 to 70% of their excess weight within the first 18 to 24 months. So what that means is that if somebody is 100 pounds overweight, in the most part, they lose 60 to 70 pounds. And that can be on either side of this number. Some people lose more, some people lose less, and it's a very individual thing. But honestly, it's much more than the numbers on the scale, right? So what's more exciting is what happens to their health conditions with this metabolic operation. So we see diabetes go into remission in around 60 to 80% of the patients, which is really very exciting, sometimes within days or even weeks of surgery even before they've lost significant amount of weight. Mm-hmm. High blood pressure improves and resolves the majority of the patients. Sleep apnea often disappears completely. People lose their CPAP machines. Joint pain decreases dramatically because there's less weight now on the knees and hips. Cholesterol levels improve. Fatty liver disease reverses. And most importantly, patients themselves, they feel that they have more energy. They can play with their kids or their grandkids. They can walk without getting winded. They can, for the first time for many patients, really go to the amusement park and enjoy so many of the rides they've never really enjoyed in the past. And many are able to reduce and eliminate medications they've been on for years.
Yeah.
So these results do vary from person to person, and success really depends on how committed patients are to following the program and making lifestyle changes. But for those who do the work, I would say that the transformation is remarkable.
All right. Well, we've got about 2 minutes left, and the last question here is, how do these compare? We've all heard about the GLPs, the Ozempics, and the Wegovy's. How does the procedure compare to the GLP?
So it's a great question, and honestly, it's one that I'm hearing more and more. And these medications have been game-changing for most patients, some patients, and I think they're a valuable tool in treating obesity. And usually they would work best for patients with less severe obesity or those who aren't ready for surgery, and these can be an excellent option for those. But there are some important considerations. For example, these medications require lifelong use. So when patients stop taking them, the weight will come back. They're also quite expensive, and not all insurance companies will cover them for weight loss. The amount of weight loss with medications is generally less than what we see with bariatric operations. And for someone with severe obesity and multiple health conditions, surgery often provides more dramatic and sustained results. And I think the metabolic changes from surgery, especially the gastric bypass, can be more powerful than medications alone, particularly for resolving diabetes and other obesity-related conditions. But having said that, these are not competing options. Sometimes we'll use GLP-1 medications before surgery to help patients lose some weight and optimize their health, and other times we'll use them after surgery as well if weight loss plateaus or if patients experience some weight gain years later. So I think the bottom line is this, that different tools work for different patients, and my job is really to help people find the right approach for their situation, whether that's medication, surgery, or a combination of both.
Right. Very good. Okay. So if people want to learn more about bariatrics, what should they do?
Well, the best ways to contact us, our website is monhealth.com/bariatrics, or you can just simply call us at 304-599-1448. Let's start that conversation.
Yeah. Give them a call, 599-1448 for Bariatrics at Mon Health. Great information. You did a great job presenting it all. We appreciate your time, Doctor.
Thank you so much for inviting me. I appreciate it as well.
Dr. Sheetal Nijhawan and bariatric surgery at Mon Health. That's Mon Health Talk for this Monday. Thanks for joining us on WAJR.